Living in harmony is possible if you know your emotions and how to handle them. Dr. Carmen Roman will share with you in an engaging way the current psychology by sharing herself or interviewing experts who will inspire you. Learn how to live a life of fullness and how to recover your emotional harmony with Dr. Roman. Welcome to Emotions in Harmony.
Hello, amigos in harmony. I am going to introduce you the credentials of our guest today, Dr. Isabella Vidriales. I want to tell you about everything of her credentials before we get into the conversation with her and her topic. In today's conversation, you are going to learn about how to detect and provide some help for people who have had before suicidal attempts or is having at the present moment. It's a very serious topic, and we want to make it as meaningful and, of course, as light as possible. I want to tell you that Dr. Isabel Vidriales is a bilingual counselor. She also speaks Spanish. She is in general working with helping assessing individuals at risk or in heavy emotional crisis. She has a bachelor degree in behavioral sciences from California State Polytechnic University in Pomona. She also has a master of social work in California State University, and she has a doctorate in counseling psychology from Argosy University. So welcome and enjoy, and please share this beautiful interview to Dr. Isabella Vidriales. Thank you, and here you have. Hello, amigos in harmony. Welcome to another video and podcast of this new adventure. Still new. We are probably in the 10 episode of this bilingual, no translation, just bilingual topic. We take, whenever possible, the same guest to do English and Spanish, and when it's not possible, I will do the other part. So thank you. The response has been amazing. It has been 10 months of the podcast. Yesterday was 10 months of the podcast. And we are just like 50 downloads away from 10,000 downloads. And yeah, my husband is clapping. He knows how much work it is. And we are in the probably 11 month or something like that of the videos, and we are near the 30,000 videos. So thank you for your help, for your preference and support. And today I have somebody who actually, I admire so much because she was so brave. She is like you, one of our listeners, and she emailed and say, I really like your podcast. And I took advantage of her kindness and invited her here because she has a lot to offer. It was like a hidden gem somewhere. Hello, Dr. Isabella Vidriales.
Hello. Thank you for having me.
How are you?
I'm doing well, and I'm very excited to be here with you and everybody else listening.
Well, you have really my admiration because just being so busy as we are and taking the time to send an email to appreciate my work, yeah, it's not about the words or whatever, it's about the act of kindness because it's a lot of work behind. And we need that kind of motivation from time to time.
Thank you.
Yeah. And then you piqued my curiosity. So I wanted to know what you were doing. I always want to know what my listeners are doing. Yeah. And I really discovered a lot of you. You guys just listen the introduction of her credentials, but I want to show you what Dr. Vidriales does. I want to show you her services because it's very important when we don't often have in Spanish. We don't often have somebody who is bilingual and can understand our language, but also can work with families. So I am here. I will be sharing the screen. For those of you who are in the audio, go to alltherapypros.com. You can say it better, Isabella.
It's alltherapypros.com.
Excellent. Yeah. And see, Isabella, I see here that you do individual counseling and social work services for hospice and home care providers.
Correct.
And mental health training for first responding. Oh, okay.
Yes, definitely. Because we, my partner and I, we have taken the time to train a lot of law enforcement about suicide risk and how to assess for it and how to make a determination if the person needs further treatment in the event of a crisis.
Wow. And so you go and train them and you tell them, look for these signals and look for these emotional signals, I guess.
Yes, we always start off by allowing them to understand what the warning signs might be. And for law enforcement, we've explained to them that families don't call 911 for nothing.
Yes.
And a lot of times it's an act of desperation on the family's part where they don't know what else to do. So if police officers are better trained to understand what's going on, they can assist the family. I mean, we know that there's research out there that shows that law enforcement is a gateway to mental health treatment.
Wow. As I am listening to you, I did that kind of training back in Mexico like 15 years ago to the police in Michoacan.
Yes.
And it was, you will be surprised how much science they miss in the psychology department. Yeah.
Yes. Yeah, it's, I'm in Los Angeles County, and luckily we do have an enormous population of mental health services, and we have a lot of mentally ill people that need help. And the district attorney made it a mission to make sure that every police officer in Los Angeles County went through a 16-hour training just about mental health and what to do and what to look for, and how better to help families, and not only how to help the families, but also how to just give them some resources. So next time they can follow up with, a provider or NAMI or someone that can provide a support for them.
I really hope that somebody in the San Jose, Mountain View, or Bay Area Police Department is listening and can bring you one day.
Oh, well, I have to tell you that I'm really happy. In Los Angeles County, a lot of police departments have a clinician that's assigned to the police department, and the officer and the clinician respond to 911 calls that come in through their system about someone having a mental health crisis. So it's actually beautiful to see two different school of thoughts come together.
Yes, that's beautiful. Say two different school of thoughts that at the moment they are extremely important.
Yes.
Wow. Well, congratulations in that job.
Thank you.
We want to actually to extract all your wisdom about this, and the parents we can avoid less of that phone calls because we can prevent more.
Absolutely. And it starts off with just really understanding what the warning signs of suicide. We do know that suicide has been around for many, many, many decades, but just now we're starting to hear more about it. There's a lot of research being allocated just to make sure that we are covering all different populations and so many studies. So it's definitely a situation where we have to be able to provide all the education to families, to schools, and even to individuals about their warning signs in the event they experience, suicide ideation.
I almost think that this episode is one of the ones that people will listen privately.
Yes.
Yeah, it's not like a more light episode, like last time was
Yes.
about mindfulness in children, or about the sparkling aspects of our relationship. I think this is more probably to listen several times.
Yes, yes. And it is very personal.
Yes.
And also the term suicide brings a lot of uncomfortable feelings
Yes.
for everyone, not only us as clinicians, but anyone. So it does take some time to process the information and just kind of get settled in with what you're hearing.
Yes. So if you are listening and you are having these uncomfortable feelings, we want to let you to know that it is okay. It is. I promise you, we will end up with some words of hope. Yeah, but sometimes it's just very needed to open doors, even to talk to yourself. And we are going to work here on how and what signs and what information is important for you and your family, because we want you to stay healthy and happy. Yeah.
Absolutely.
Yeah. So if you need to listen privately, if you can send an email, text to any of us, both of us, just please remember we are not that service, that 911 service, even though Isabella is trained in the police department. We are not incapacitated to answer any emergency phone calls or emergency emails. And definitely, even though we are both therapists, we are not intending to provide therapy. We really want you to set you with good tools for you to get therapy if you need it. Yeah.
Right. Yes.
So that said, let's start with this beautiful topic.
Thank
What
you.
are the signs or the early signs, I will say, of the suicide?
Well, I just want to maybe touch on the research just for a little bit. And this research is very, it's current, and suicide is the 10th leading cause of death in the U.S. Men are 3 times more likely to commit suicide than women. And the research is showing that 7 out of 10 of those males are Caucasian. And this is 2016. Firearms is what's been accounted for on 51% of the suicides that have been completed in the U.S. The other thing, too, is that 90% of people that have committed suicide, there is a mental health problem. It can be anything from, depression to anxiety. It can be anything. But at the time of the suicide, they have found that there has been some symptomology that was involved prior to making this decision. Now, in terms of the warning signs, the first warning sign that's out there is the person talking about wanting to die. Are they saying, I don't feel like I should be here. Maybe the world would be a better place without me. The next thing that you start seeing is they start doing research about suicide. The research can consist of finding out the different methods, of finding out what people have done to commit suicide, or even how to get help. But there is some research that's being done for individuals also experiencing suicidal ideation. They tend to isolate completely from their families. They want, they're not the same person that they were prior to experiencing this, where they don't want nothing to do with the person that they have a really close relationship. They probably don't want to have any contact with anybody for that matter. They sleep too much, or they don't sleep. They might maybe start using drugs or alcohol. And if they were already consuming alcohol or drugs, they start increasing the intake. So it starts kind of getting a little carried away. there's a lot of irritability. There's a lot of rage. There's a lot of, you see that the person is not who they used to be. And for children, they journal. And, we know that children will communicate things differently from adults. Sometimes kids don't know how to communicate. So journaling, when they start writing down what they're feeling, you can get a sense of what's going on if you're able to read a journal.
Wow. So I will ask something. Do you have any sense of how, if there is a term of weeks or months or whatever that the person starts before? Or they can research for years, or?
It can take, it can be years, because people do get better. So for instance, if somebody's having suicidal ideations or having some thoughts, and they're just maybe not even contemplating, but they're curious about it. And then something good might happen in their life where everything goes back to normal. And maybe 6 months from now, there's another trigger that might have triggered that suicidal ideation. And now they can start not only, all over again. Well, they do start all over again with the process of reading, searching materials, talking to everybody about how they feel they're a burden, how the world can be better without them, or a lot of feelings of hopelessness. And I think out of everything, that's one of the signs that really does worry me, because most of us, it doesn't matter what kind or what type of day we have or what happens. Sometimes we know that it's going to be okay, or we can still see the future. But someone who really is set on committing suicide cannot see past what they really need to see. I mean, tomorrow, they don't know they're going to be alive tomorrow, where somebody else is having a bad day and saying, okay, well, next week, I'm just going to go to the movies and I'm going to debrief with my friend. They have something to look forward to. But for someone who has absolutely nothing to look forward to, it's a huge concern.
And what is it that is a common sentence that they say, oh, I am suicidal, but I can, this is not it's a common sentence in the psychology, but not in the families, but it can be some passive suicidal.
Yeah. And I always say this. I mean, all of us as human beings, we've had probably some really difficult times. And when I think of a passive suicidal ideation, I think of, I wish I can just go to sleep and not wake up, but there's no actual plan. Okay. I wish that didn't exist. I wish it would go away. I wish there was an earthquake and it can just take me with it, kind of that. But that's passive. But I also think that that's used as a defense mechanism, because it takes you away from what you're feeling at that moment. So by you fantasizing that you wish you can go to sleep and not wake up is a way of you protecting yourself from what you're feeling, which can be those uncomfortable feelings at that moment.
It means that reality is too painful.
Absolutely. Absolutely.
I actually hear that sentence this week from one of my friends. Is like, oh, if I disappear, like nothing will happen. Yeah. And this kind of sentence are like, yeah, you're right. This kind of a way to avoid that painful reality.
Absolutely, because we know that it's very uncomfortable. It is very scary. And having to kind of work through finding some solutions to help you overcome that. It's scary. It can be, it takes a lot from the person. So it's easier just to say, I'm just, you know what? I don't care. Hopefully I go to sleep tonight and there's an earthquake in the morning and everything's all forgotten about.
I used to think that is, it's not comforting, because thinking that way is not comforting, but this is a way of sitting too much with the pain.
Yes, absolutely. And pretty much just like fixating yourself with this. I mean, just over and over and over. But you're right. I mean, and I always say as human beings, we've all experienced something that might have maybe made us feel very uncomfortable or something that we had to work through. And it is possible to work through that. I mean, you and I both, I'm sure we have experiences with clients that have been through so much, and they've worked so hard to get through that. And that's admirable. So it could happen. I know it takes a lot of effort from the person, and you have to be able to really tap into those uncomfortable feelings, but it's always good when you have the right support.
So this means thinking about suicide is not necessarily being suicidal.
No, it becomes more of a concern when there's a plan.
Okay.
A plan. So if you have, and I'll just say, I'll put it very general, especially for us clinicians, if we have someone in our practice who's saying they are thinking of killing themselves, you want to find out how often have they been thinking about this and how do they plan on doing it? So let's say the person says with the firearm, you want to find out, does this person have access to a firearm? Because and then that right there really does intensify the situation. So always, we have to consider the means, and it's not, if they have a plan in place, it means that they've done some research, which means that they're really thinking about it, which means the possibility of them completing suicide is probably very high.
So, I had been therapist most of my therapist years in Mexico, and the last 7 years here. So I have been 25 years therapist. When I came here, I noticed that people don't want to talk about their suicidal ideation because it exists something that the therapist will put them on hold for 3 days or something like that. And so I found that it was difficult for people to start talking until they realized I am just different, yeah?
Yes.
And they start talking, but they were afraid.
Yes, they are afraid, especially because they know that we are mandated to ensure that they're going to be safe and that we're going to keep others safe. So they do. But I also have to say, and there is research on this, is that there is a lot of clinicians that are so afraid to ask.
Yes.
Are you feeling suicidal? Are you having thoughts of suicide? Because the myth is that if we ask, that now we just gave them an idea of what to do in the event that something goes wrong in their life. Or for us, we can say, if he or she says yes, what am I going to do?
Thank you. Yeah, thank you for that, because it's like, I usually ask those kind of uncomfortable questions in therapy, and they feel like, should I answer? Should I know? And I say, you can answer. We will work with that. Yeah.
Yes. And the clinician is like, what do I do with this? I'm scared. What if my relationship is ruined because I have to intervene? Who am I going to call for help? What do I do?
Yeah.
So it does have, it comes with a lot of different questions, and it is very uncomfortable. But, I know at the end of the day that we have to do what's right for our patients, for our clients that we treat, and they know that. When they work with us, they know that we are fully invested in their treatment, that we've connected, and that, we're here to make sure that we can provide a safe environment for them to be able to talk about some of these feelings that are causing a lot of uncomfort.
And as a practitioner in both countries, I find a blessing to have these rules in place, that I am mandated reporter. I can mandated reporter for me. It means that I can pull resources.
Yes.
And they need to answer me. Oh, that's amazing. Yeah.
Yes.
Yeah.
Yes. And, I've spent probably about, I've been in mental health for about 18 years, and 5 years I did inpatient psychiatry, where I saw patients coming in who were suicidal. So I got to work with, these patients. The other 8 years after that was doing suicide risk assessments, and making that determination if someone needs to go into a hospital on a 5150. And one thing that I think is so, so important is also bringing in collateral information, because in our case, it was more difficult for me because I didn't have somewhat of an ongoing therapeutic relationship with the person. I was just called specifically to come and do this assessment. So I didn't have a baseline to go by, where if you're in therapy, you have a baseline. You're able to see, like, he's been doing very well for the past year, and past 2 weeks, he's not the same. I need to explore further. But bringing in the collateral is always good. Family, what does family say? If you have a consent to speak with family members, you might want to ask them, have you seen any signs that are concerning? Anything that you can share that would help me maybe address with him in the session.
Yeah. Wow. What do we do when when a person that we love is suicidal?
We have to, if it's we're going to take a family member, or our son or somebody, our daughter, but the first thing you need to do is you need to be aware, right? You need to be aware of the signs. And obviously, if it's a concern, you somewhat have some awareness of what's going on with the person, but you need to get involved. You need to be able to be with your family member without blaming anybody, without even blaming yourself, right? And I think it's normal. You get a lot of parents that say, it's my fault. I was working too much. It's my fault. And so it's not blaming anybody, and just being with the person in that moment to give them the support, not blame them, or not even ask them, hey, wait a minute, why are you feeling like this? You shouldn't feel this way. Well, that's, again, kind of putting blame on them. But you want to be direct too. You want to have that talk. Talking about suicide is always like that elephant in the room. It's very uncomfortable. And even for a parent, you don't want to ask that because you're so afraid of your child saying, yes, I have. And it's heartbreaking. But if you have the straight conversation with them about how they're feeling, and if you determine that they have been thinking about suicide, the best course, the best intervention is seeking treatment immediately. But, you have to understand where they're coming from. You have to show empathy instead of sympathy. You have to, accept them for who they are.
So if a therapist will be sort of sometimes impacted by the comment, I can imagine a family member, yeah? A family member will be impacted too. And I like that you say, just go and ask for help. You don't need to solve it yourself as a family member.
Yes. And families sometimes, it really depends on cultures. We know that there's certain cultures that they're so proud, or they're embarrassed to go and ask for help. So a lot of it is just kind of working through those barriers. But in the past, when I've had families who are reluctant to seeking help, at that point, I just have to be really direct with them, and even share the research as to what happens, and give them the hope that they need, that there is, even research does show that if your loved one is in treatment, that things could get better.
Yes.
If they're seeking, individual therapy, if maybe the psychiatrist started them on an antidepressant, that it's going to get good. It's going to be okay.
Yes. And let me share with you the main things that I see. People, especially the communities that are low income, they are afraid of the hospital bill. And some people are afraid of, I need to go to work. Yeah, it's like, I know my child is feeling that way, or I know my partner is feeling that way, but we cannot miss the work. Yeah. Or those kind of things.
Absolutely.
Mhm.
It's very interesting you say that. I'm Hispanic. My parents are from Mexico. I understand that dynamic that comes with our Hispanic population. We get, in Los Angeles, there is a lot of first generation Americans, and you have these families that come to the US to work so hard to provide for their kids so their kids can get a good education. So in doing that, sometimes they forget to be in tune with the feelings of their kids, because in their mind, they believe that being a provider is showing them that they love them. And there has been some situations in the past where mom has says, if I miss work, I'm going to get fired.
Yes.
And it's so difficult and it is so heartbreaking because again, you don't want anybody to get fired, but you also want, this child to get the appropriate treatment because, if you start looking at things and it gets worse, I know that mom's going to wish she would have intervened early on.
Yes. Yes. And actually, the earlier we intervene, the easier.
Absolutely.
It is. And yeah, there is a reality. Probably you will lose that work. And it will be 3 days with no income or whatever. That's part of the reality. But first of all, why you want to work for somebody who doesn't help you when your child is in that emergency?
Yes.
And
yes.
second, you will be so happy when your child starts smiling again.
Yes, and I've told some of these parents, I can't imagine what it's like for you to go to work and have this in the back of your mind.
Yes.
You can't work comfortably, and it's really a disservice to you and to your family and even to that boss you're very concerned about. It's a huge disservice for everybody. So, it's best that you're right. You might maybe lose a couple of days of pay, but things will work out and your child will get better and then you'll be better. And then you can go to work feeling more comfortable that your son or daughter is receiving the appropriate treatment.
Yes. Or yourself.
Sometimes. Or yourself, yes.
Yeah, sometimes it's like, I can take this time to go and take time for me to heal and work better later.
Yes.
Wow. What other behavior? Well, this is another question. What behaviors could be mistaken for suicidal intentions?
You see this a lot with adolescents or maybe some early adulthood, the cutting behavior. So you'll get someone you get a child who goes to school and might have some very minor lacerations on, the arm, or in the leg. And when it's brought to the attention of the school officials, they automatically attribute that behavior to the student wanting to kill himself. And in interviewing a lot of these children, it's not that they want to kill themselves. It's just that they've experienced something so traumatic that when they cut, it releases that tension that they're experiencing, and it kind of shifts. Now they're focused on a little bit of the pain versus the internal pain that they've been suffering from. So when when I assess for that, I always ask, okay, so, how long have you been cutting? Tell me a little bit about when you cut. So identifying the triggers associated with the cutting. And do you have any thoughts of wanting to kill yourself? And a lot of times it's no, and a lot of times it's yes. But one thing to consider is, where are they cutting themselves? If it's maybe, up and down their wrist and it's a deep, I might not think that that's a gesture that was just to maybe relieve themselves. I might consider no. I think that's possibly suicide attempt versus, taking like a razor and just cutting on their, on their thigh or on their leg. But again, I mean, that's how it kind of gets really mistaken, as a suicide attempt.
Do you have anything or any beautiful story or something to finish in a good note before I put you in the hot spot? Because it is a very serious and interesting topic. It is. But, in therapy, that's only part of the experience.
Yes.
We don't go, people even who is suicidal, they don't go suicidal 24/7. They go suicidal for moments.
Yes.
Yeah? And they have life and they laugh and they come back to happiness again. Back. So tell us something beautiful about your profession.
Dr. Ramon, I have a lot of success stories that I've seen, and it feels so good when we are able to intervene right before anything bad happens. And this is why it is important, and it's my passion to educate people about what these warning signs are, what the risk factors are, and what they can do in the event that it gets worse. But I mean, I have to tell you, I've seen people, they get into treatment, they get into therapy, they do fairly well. They end up, becoming adults and living a nice, productive life. And whatever happened in their adolescence is a past, and it's an experience that they learned from. But now, I mean, they're more resilient. They have better coping skills. And they're able to live a normal life, just like any one of us. We can all, with the right treatment. I mean, because for instance, what's traumatic to me may not be traumatic to the next person. So trauma is how you perceive it, right? And there is a lot of children, especially children that live in the inner cities, that have experienced what I would view as very traumatic. And then for them, it's kind of just part of the everyday life in the neighborhood. So in figuring out like what history of trauma, which that's one of the huge risk factors, is the impact it had on the person. Well, how do you use, I know you saw somebody get shot in front of your house. What was that? How was that for you? Tell me about that. And, I mean, sometimes you start seeing how it really did impact them. Other times it's just like, well, I mean, it's not the first time I've seen it. But, same thing. And the other, I've seen families, women, I've seen men who do get better with the right treatment. All the research shows that you have to be able to, that if you get on medication and you seek individual therapy, both together, you're going to pull through completely and have your support system, have people identify a support system that can be there for you when you start feeling a little down, because we know it's normal to feel down. It really is. But it's more difficult for someone who has that history of suicidal ideation ongoing, because when they feel down, the first thing they want to do is take it to where they were at before, which is those thoughts.
Yeah. I actually have seen people who I will see like acknowledging those thoughts.
Yes.
Or working through with your therapist or whatever. It takes the big monster. It puts light into the darkness.
Yes.
And I see them come stronger, but also more willing to laugh at the situations, at themselves, are more lighter, I will say.
Yes.
Yeah.
Yes.
Because we need spaces to talk about our darkness.
Oh yeah, absolutely. Yeah. We need a safe space, and I've told a lot of a lot of clients that I've interacted with in a crisis setting is you need to find that therapist that you can just let him or her know everything about you, because believe it or not, we're not judging. Therapists, we don't judge. You can't scare us. Yes. We've heard it all, but we just want to know your story so we can work together on maybe figuring out ways of coping with what you've been through.
Yes. So let me put you in the hot spot.
Okay.
Talking about darkness, or I will put you in the hot. Dr. Isabella Vidriales, what is a daily habit that you believe contributes to the emotional success of a suicidal person?
I would have to say structure. So for instance, you have to be very structured. You would have to, the person that's feeling suicidal, like if you provide that structure for them, okay, you're going to wake up in the morning and you're going to have breakfast and maybe you're going to call, that one person that you feel very comfortable talking to. You're going to speak with that person. Then you're going to go to school, and kind of that structure. You have to be able to get good night's rest. Not be up all night wondering and thinking. You have to be able to sleep well, exercise, find some hobbies that can help you with the distraction of some of those uncomfortable thoughts. I've had situations where I've had clients that have to identify at least 5 people of support and call them, once a day just to say, hi, I'm doing well. How's everything? Mm-hmm. And then that becomes a habit. And then that really feels like they have that support from others. And, so it's just, our mental health. What does it consist of? We have to eat well. We have to exercise. We have to be able to find hobbies and again, self-care. What is it that we need to do to make us feel better, to make us feel alive again? It can be a walk in the park. It can be watch a movie every Friday night, whatever it is. But that's what we need to do and provide that structure.
Wow. What are the online and any online resource that is valuable for your clients in this situation?
There's, and maybe I can give you those and you can maybe incorporate them in your show notes, but there's a lot of talk, like suicide talk hotlines. If the person's feeling suicidal, they can talk to somebody. Mm-hmm. There's, mental health resources. I know that in the U.S., every county has some type of mental health resources. That's always a start as well. Finding out the nearest mental health clinic and maybe calling and seeing if you can come in or if your loved one can come in. There's a few, but mainly are the ones where they're allowing the person that's feeling suicidal kind of do the outreach for themselves, where the clinics can be for the client, but more for the family as well. Okay. But I'll give you that information and we can
put it in the notes.
Yeah.
Or if you are in the Facebook, we will put it in the comments or something like that. And if you are in Facebook and you know that when it's a guest, we are pre-recording this interview, but we are there. It maybe Dr. Isabella can be at that time exactly, or I am always there when is this airing live. So you can always ask questions, and if you want to ask any question that is more private, feel free to send it in a message. Don't post it publicly. You can send a private message, and we will send you the resources as well. What is the favorite book that you have?
I don't have an actual favorite book, but I have a really great documentary that I watch.
Okay.
And this documentary captures everything that has to do with risk assessments and suicide and hope. And it's called The Bridge.
Okay.
And it's The Bridge, and you might be able to find it even on YouTube. But with this in this documentary, the producers they put cameras facing the Golden Gate Bridge in San Francisco, and
wow.
So they were able to capture people actually jumping from the bridge, and what they did was went back and interview their family members or their friends. So to me, when I saw that video, it really did help me as a clinician, because you start looking at the different families and friends, and all the warning signs were there. So, and there is one person that survived it. Believe it or not, survived that fall, came back, talked about his experience, and now has gone all over the world talking about his experiences and really promoting mental health.
What a beautiful idea. Yeah.
Yes.
I will look for it.
Yes.
So it's called The Bridge.
The Bridge. Yes.
Excellent. Wow. What tip you will give to somebody who is suicidal and need support, or need to ask for the family member support?
You have to be, if you're feeling suicidal, you have to first find that one person you feel very comfortable with, to talk to that person about the way you're feeling. Now, your primary doctor. We know, for instance, in our culture, the Hispanic culture, you get a lot of individuals that don't want to see the psychiatrist firsthand, so they go directly to the primary doctor, who can give them some more information on, what next, right? And even prescribe some medications. I've worked with a lot of older generation Hispanic ladies that refuse to go to a psychiatrist. So their primary doctor will consult with the psychiatrist and to figure out what medication the primary doctor can prescribe, because they refuse to see a psychiatrist. So that's a start too, is talking to somebody. Now getting into some, counseling is also good. But a person who's feeling that, I mean, there is hope. There's so much hope. There's a lot. I mean, I've told people, like, don't cheat the world of who you are as a person. You have so much to offer the world, and right now it just feels horrible. But, once you get into treatment, once you have therapy, you're going to talk, and you're going to feel so much better. And all this is going to make you much stronger.
Let me tell you my approach, and you correct me if I am wrong. My approach is that somebody who is suicidal, there is a part of him or herself that wants to die, that is in desperate need to die, but not the whole person.
Yes.
We just get confused and we want to kill all. Yeah.
Yes.
So there is always, like, let me put you examples. Like, I have the mom whose children will go to college and her role as a mom is dying. She needs to discover her role as a partner and as a woman. But her role as a mom is dying, so she's trying to commit suicide. Or I have the teenager who the parents are divorcing, and now he or she needs to find herself in the world.
Yes.
And it's a new part. Something needs to be born. And those are the moments which I take very sacred.
Yes.
And very beautiful. And we can even do a funeral for the part that needs to be dying. Yeah.
Absolutely. Absolutely. And, and talking to, like I mentioned, I worked in an inpatient psychiatric facility, and in talking to people who actually attempted suicide, they talk about, like, half a second after they regretted it. So to me, that tells me that they weren't fully ready to die, that there's a part of them that still wants to live.
Yes. Yes. Wow. It was so beautiful talking to you. Thank you, Dr. Vidriales.
Well, thank you for having me. I really appreciate it. Like I said, I heard your podcast one time. I don't know how I came across it, but I fell in love with you without even knowing you. And thank you so much for doing the work that you do and for helping everyone in our community.
Thank you. And if you ever think another topic, please come and share with us, because we are always eager to learn about clinicians like you and with all of your expertise and everything. So thank you.
Oh, thank you for having me.
We are closing for today. Thank you, wonderful listeners, and now video, for staying in tune with these very, very interesting topics. We want to keep you alive, healthy and happy. Now, Dr. Vidriales, before we close, how they can share this information? It's kind of how you say to a friend, hey, here, I listened this about suicidal thing.
I think what you can do is just listen to, we all will come across somebody who might be experiencing something, or know someone that's going through something else. So you can always say, hey, listen, I really don't know what's going on, but I did listen to this podcast, and they gave me a lot of information. So I want you to know that it might be a little normal. It's not the end of the world. It's normal for people to experience, some type of passive suicidality. But here you go, listen to it. And again, it's how we normalize it, because I think now in where I'm at in my profession, I've normalized it, as opposed to maybe, 20 years ago, I would have been like, no, you can't do that. You know what I mean? A little bit, not so much judgmental, but a little bit more taking on that more concern, like you shall do this or you shall do that.
And also, I will give you homework if you are a listener or a follower, a Facebook follower. Just take the link, copy it, and send it to all your friends. In that case, you don't need to explain anything.
Yes.
You just say, Dr. Carmen Roman gave me the homework, and let me tell you why it's extremely important that you share this. Because between you and I sharing all of this information, and Dr. Vidriales and all of the clinicians that we work, we save one life. We say that work was really worth it.
Absolutely.
And we depend on you to share it. So normally I will say, please share. This time it's mandatory. Go and take the link and share it, because we want to save as many lives as possible. Yeah.
Absolutely.
Thank you. And until the next time.
We have ended one more episode of Emotions in Harmony. See you the next one, when Dr. Carmen Roman will help us to have a more fulfilled life caring for ourselves and the ones we care for. Meanwhile, visit www.emotionsinharmony.com to see the show notes, subscribe, and enjoy more content.